Good evening, ladies and gentlemen, and welcome to another information session from the Greyhound Adoption Program. Before I introduce and give you a bit of an idea of what we have coming on for this evening, just a couple of aspects of housekeeping. First of all, I'd like to begin by acknowledging traditional custodians of the land on which we meet today and pay my respects to their elders past, present and emerging. And I extend that respect to Aboriginal and Torres Strait Islander people here with us today. My name's Phil Weir, and I'll be comparing, semi-hosting this evening's session. This is the fourth of our sessions. We've spoken about fostering and adoption and many other aspects, but tonight we have the wonderful opportunity to be sharing the airtime with Dr Bec, colloquially known to most of us as Dr Bec, who's the in-house veterinary surgeon at a Gap in Seymour. You may have met her if you've been up there. Now, what we'll be doing this evening, first of all, you may have realised or you may have known that originally this was going to be a pre-recorded session with Dr Bec. We've been lucky enough to have her here live with us tonight. We did email out a survey for a few weeks ago asking for the sort of questions that you would like to ask Dr Bec. We still have those questions, despite the fact that she's also here with us tonight. So I'm hoping we're going to cover a lot of the questions that you have already sent through to us. If you have any extras, please put them in the chat and we'll come back to those a little bit later if we have time. We do really need to keep it short so we can all get some sleep tonight. And I know every time we do this with Dr Bec, she's extremely popular. We get a lot of questions and a lot of comments, but please also remember, this is not a session with your vet. This is not a visit to the vet with your greyhound. And if you have any concerns about your greyhound, specific concerns, you should book in to see your veterinary surgeon as soon as possible. I think that's enough for me for now. I'll be back shortly with and go through a lot of those questions that we've received from you over the last couple of weeks, and we'll have a chat to Dr Bec and see if we can answer those for you. What we do have is a presentation from Dr Bec, and this is about all things paws. These are the 4 contact points that your greyhound has with the world, and as such are very, very important for such a unique dog. So without any further ado, I would love to introduce and welcome Dr Bec. Good evening.
Thank you, Phil. That's very kind of you. Now I'm just going to share my screen so that you can see my presentation. Bear with me just a minute, everybody. And I'm just going to turn off my camera so you can concentrate on what I'm saying. So I hope we're ready to go. So thank you again, Phil. Hi, everyone, and thank you for being here tonight. I'm going to talk with you this evening about something that as vets we see really commonly causing problems for retired greyhounds and causing a lot of problems for their owners too. So welcome to pad and paw problems in pet greyhounds. So just to start with, I thought I'd talk to you a little about why we see greyhounds visiting vet clinics. Oh, sorry, I'm just going to try and get rid of, there we are. So some of these reasons are universal for all pet dogs and some are more greyhound specific. We see them for vaccinations and worming, so their routine yearly health checks and making sure they're up to date on flea and worming control. Generally, pet dogs should visit the vet at least once a year, although our vaccine protocols have changed a little, we still need that 12-monthly health check. We also see greyhounds a lot for dental checks, assessments and for dental cleaning. Many of you know that greyhounds are predisposed to dental disease, and so this is a real focus of preventative care for these guys. I have to say that you should all be very proud of yourselves, because I also think that greyhound owners are the best toothbrushes around. We see them for gastrointestinal upsets and dietary advice. I spend a lot of my time talking about greyhound poop, and we'll probably talk a little more about this later on. We see them for osteoarthritis management. Not surprisingly, in a group of former elite athletes, and especially as they age, we need plans in place to manage creaky joints and stiffness. We see them for lumps and bumps, and for behaviour, often issues related to many dogs' intense belief that they need to be stuck to us like Velcro 24/7. And last but definitely not least, we see them for lameness. So lameness is one of the most common presentations of pet greyhounds to our vet clinic on a daily basis. Let's delve a little deeper into the lameness thing. And before we do, I just want you to look at the picture on the right-hand side of my screen, because this is the way that many greyhounds spend 90% of their retired lives. Well, not exactly like this, but most greyhound owners will report that their dog has a close relationship with their couch or their bed or anything that's soft and fluffy and helps them sleep like a baby. And this is relevant because unlike racing dogs, who are often on a daily or at least weekly basis experiencing high impact exercise at up to 70 k's an hour speeds, our retired population is more adapted for a life of leisure. So the lameness that we see as retired greyhound vets is likely a little different to what the vets who treat racing dogs are seeing. Having said that, we do see soft tissue injuries such as muscle, ligament and tendon strains and tears, even in pet dogs doing Athome. As I mentioned before, we can see lameness related to old injuries and osteoarthritis, especially as dogs enter that geriatric or over 8 years category. Sadly, we sometimes see lameness due to cancer in our pet dogs, and in greyhounds, this is most commonly due to osteosarcoma or bone cancer, for which this breed is predisposed. But in pet life, by far overrepresented as a cause of lameness is paw and pad problems. So let's drill down even a little further and look at what goes wrong with paws and pads. We can divide paw problems into 3 main categories, which correspond to parts of the dog's anatomy. These are nail problems. So they can be broken nails, especially dew claws, but any nail can be damaged. Infected nails, and in greyhounds and some other breeds, a condition called SLO or SLOD, which I'll go into in a little more detail later on in the presentation. Toe problems. We see arthritis, ligament injuries, dislocations and fractures, and injuries to the skin and the webbing of the toes. And we see pad problems, most notable among these being corns, foreign bodies, and other pad issues such as excessive wear or ulceration. So just a refresher on why pet greyhounds see vets. Often it's due to lameness, and often this lameness is related to the paws or the body below the wrist and the hock joints. And when we do see problems with the paws, most frequently it's because of problems with the pads. So how can you tell that the pad is the problem in your lame greyhound? Sometimes you can't, and sometimes even your vet can't, but some hints that the issue is related to the pad might include a lameness that is worse on hard or rough ground. A common history that I get presented with is that my patient can run like a champion on the grass, but is 3-legged lame on the footpath or gravel footpaths. And this is not a hard and fast rule, but often pad-related lamenesses don't respond well to anti-inflammatories, especially for corns. Sometimes we might see, or more commonly feel, a swollen end of the toe, a toe that feels thick compared to surrounding digits. You might notice first that the nail on that toe seems to be sitting up at a slightly different angle from the rest of the toes, which can happen with swelling of the pad. If we're lucky or unlucky, depending on how you look at it, we might actually see a lesion on the pad, a puncture or a mark. Sometimes these are easier to see if the pad is wet. You can just wet it down with a little water, and in good light, you might see something there. Further confirmation that the pad is likely to be causing the problem might be discomfort if we gently squeeze across the toe from side to side. This is a more sensitive way of assessing discomfort than pressing directly down on the pad itself. Be careful and be gentle. Remember, doing something aversive or something that causes pain might result in your dog reacting defensively. Even the gentlest and most trustworthy soul might react by snapping or screaming. So let's look a little further at pads on dogs. You would think that a pad is a pad, right? We all know that dogs have 4 digital pads. So these ones here. And then the big one in the middle, which is called a metacarpal or a metatarsal pad, depending on whether it's on the front or the back paw. And if we look at the picture on the right, we can see inside the anatomy of the toe, we can see the 3 toe bones. So 1, 2, 3, with the last toe bone firmly attached to the nail, and the hard layer of the pad down here, and then the softer fat pad that acts like a cushion to the toe, and especially the end of the second toe bone, which is just here. But not all pads are created equal. We know that greyhounds have a high muscle to fat ratio than any other breed of dog, or many other breeds of dog. They have a lot of muscle, but comparatively not much fat, both under the skin and in other places as well. There are indications that this might be the case with a fat pad in the toe also. The greyhounds may have a smaller fat pad here and also a thinner pad itself, which might predispose them to all of these paw problems. The first pad problem that I'd like to talk to you about today is the one that I think, at least in our practice, we see more commonly than any other. And that's what we call grit in the pad. This is probably more of an issue in dogs that live in suburbia and are pounding the pavements of our lovely cities than it is for those living rurally, but it can affect any dog in any location. So what goes in? Most commonly, we see bits of gravel and sand. We also see glass and metal fragments. We've also seen some really left of centre things. For instance, we have pulled out half a tiny orange plastic bead, which you'll see in an X-ray in a minute. How does it go in? Sometimes it might go in through the pad, through a cut that's already there, but in many cases, the grit or glass gets stuck onto the outside of an otherwise healthy pad. Especially if it's sharp, if it's imprinted onto the pad as the dog continues to walk, just like a piston, every time the dog bears weight on that pad, that little piece of grit gets pushed further and further and further into the pad. Once it's in there, it can continue to move through the pad tissue, causing inflammation and sometimes infection, and it can migrate further up the digit and get caught in the tendons attaching to the toe bones. So what does it look like? In clinical terms, we might have a history of a dog that was very obviously lame initially, seemed to get better, but then has returned at a lesser severity and seems to bother the dog more when it's walking on hard or rough ground. We might see a swollen toe and we might see a lesion on the pad. So this photo on the left-hand side almost looks like a setup, but this is actually a little piece of gravel stuck in a dog's toe that I saw at the GAP clinic. It's been there for a fair length of time because you can see that the pad has started forming a ring of hardened or cornified tissue around it. More commonly, you might see something like the middle picture or even this picture on the right if the grit ingress happened a fair while ago and the pad has healed over the surface. Corns can form secondary to grit ingress, and so clients will often present a dog that they think has a corn and it might have developed one secondary, but the primary problem was actually grit. So how do we confirm grit in the pad if we can't see it on the surface? We need X-ray. So here you can see one of our beautifully compliant X-ray patients is assuming the required position. Most greyhounds are really cooperative of this process and we don't usually need sedation for these X-rays to be done. We use a little portable dental X-ray machine, which looks like a big camera, and small plates that we slip under the dog's toes to take X-rays, usually from above and from the side. And this is what X-rays of grit might look like. So you can see the grit or the foreign material up here. And it appears as very white against the background of the toe tissue. And this one over here is an X-ray of that little plastic bead that I talked about earlier. Before we go on, I just want to show you an X-ray that might help you understand why timing matters in these cases and why, if you think your dog has had a puncture wound or grit injury, that waiting before taking them for a vet visit isn't a good idea. The X-ray on the left shows a picture of grit that has only recently gone into a toe pad, while the one on the right shows grit that has been there for some time and has moved through the pad with quite large pieces in lots of different positions. The prognosis for the dog on the left is much better than the one on the right, where there is likely to be a lot of chronic inflammation, and successful removal of all grit pieces will be very challenging. So if we find grit in the pad, what do we do about it? The treatment option is really only attempted surgical removal of the foreign material. This might sound easy, but removing grit can be like finding a needle in a haystack. While X-rays can help direct us to the right area and repeated x-rays can confirm that we are removing the pieces successfully, it can be a very long and frustrating surgery and can easily take as much time as a complicated dental or even an orthopedic procedure. And from an owner's perspective, as I'm sure some of you already know, it can be an expensive exercise when what you thought was just a little splinter turns into an epic bigger than Ben-Hur. And the management only starts with the surgical removal. Following this, dogs will need their paw bandaged for 2 weeks with regular bandage changes, and then we'll need another 2 weeks of socks and boots to protect the healing pad and prevent any more grit from entering the surgical wound. Infections of the toe are common both before and after surgery, and dogs are usually on long courses of antibiotics and pain relief. So how do we prevent it from happening in the first place? This is probably the most important reason that I've chosen to present on this topic to you today, to make everyone aware of what a problem this can be so that we can try to avoid it from turning into a visit to our veterinary hospitals. Prevention can be thought of as a two-pronged approach. Firstly, we want you to get into the routine of checking your greyhound's paws when you get back from walks, especially if those walks are in areas where there's likely to be a fair bit of glass contamination on pavements, or it's on sandy gravel tracks like the tan type surface. This can be more difficult with paw sensitive dogs, but it really just involves turning the paw over to look at the surface, brushing over with your hand or a face washer or a cloth, and using your fingernail to pull out any bits of grit that are sitting just on the surface of the pad. The second part of prevention is boots. These won't work for every dog, but for repeated grit offenders, they're often very important at preventing grit ingress. Getting the right size and learning how to put them on securely will help to maximise your success with boots and your dog. So now we're going to move on to a pretty much sighthound specific topic, which is corns. Corns are circular raised lesions on the pad of greyhounds. They can be found on any pad, but they're more common on the pads of the middle toes, most common in a central location on the pad, and more common in the front paws and the back paws. Clinically, what we see are dogs that are particularly lame on hard or rough surfaces. Sometimes they look like they're walking on hot coals. And dogs shifting weight onto the back of their pads, and when the paw is examined, you'll often see a lesion that looks like this, depending on how keratinized or hardened the corn tissue is. So this is usually the pictures on the left, and the middle are usually what people will see. The picture on the right is probably actually the biggest corn that I've ever seen. And you can see on the profile exactly how far out from the pad that corn was sticking. Over the years, various causes have been advanced, such as viral, which is thought to be incorrect, as no viral DNA has been found in over thousands of sampled corn tissues. Because of overlong nails, although there is likely an association with long nails, it's more likely that the nails grow long because of corns and not the other way around, as dogs with corns will often shift their weight back on their paws and essentially walk on the back of their pads. This could result in nails not wearing down as they normally should. More likely, corns may be a result of special anatomical and biomechanical characteristics of greyhound weight bearing, and there are investigations ongoing at the moment into whether genetics plays a role in why some dogs develop corns and others don't. When we talk about treating corns, I always talk to owners about management rather than cure. A dog with one corn is likely to go on to develop corns on other toes at some point in the future. Our aim with treating corns is to manage the pain associated with the lesion, and the best way of doing this is different for each dog and to some extent for each owner. In general, I like to think about corn management as falling into two camps: the conservative or medical management and surgical options. So conservative management aims to soften or remove the hardened centre of cornified tissue that forms a corn. Most of these treatments are not aimed at resolving or curing a corn, but knowing that the pain comes from stepping on the convex, protruding hard tissue, which is like a pebble in your shoe, we aim to either cut out the corn with scalpel blades, for instance, like the picture down here on the left-hand side, or soften it enough with paw soaks. So online you'll find Epsom salts as a favourite, so that the corn either falls out or can be pulled out. The tissue will regrow, but the dog is provided with temporary relief that can last for weeks or even months after hulling or pairing and before the corn grows back. In addition, conservative management is likely to involve using boots. Boots act like a shock absorber to provide padding between the corn and the hard ground. So they cushion the impact of bearing weight on the corn, and that helps reduce discomfort. We might recommend surgical treatment if hulling and boots is not enough to give adequate pain relief. Some dogs are just too sore and don't get enough relief from conservative treatment, requiring more invasive procedures to help alleviate their pain. The traditional surgical approach to corn management is surgical excision of the corn and the deep layers of growth tissue that it comes from. We make an elliptical incision in the pad, remove all the tissue, and then suture the pad up. This leaves quite a big surgical wound depending on the size of the corn, and a smaller pad as tissue has been removed. The surgical wound must be kept clean and dry so that it doesn't get infected or get grit in it, and so requires bandaging for prolonged periods of time, often longer than 2 weeks. Recovery from surgical excision can be 2 to 6 weeks all up. Unfortunately, the success rate of this technique is only 50%. So while half of dogs do achieve good pain relief following this recovery, the other half will go on to reform a corn on the toe. These statistics aren't great, and considering the length of healing time, this procedure has fallen out of practice as the best way of surgically managing corns. The surgical procedure that's most commonly performed these days for managing corns is a superficial flexor tenotomy. In this procedure, the flexor tendon at the back of the paw is released, which results in the toe flattening out. This helps with corns because as the dog bears weight on the toe, the force is spread across the entire length of the digit rather than being concentrated at the middle of the pad. This is a simple procedure which can be done under sedation and local anaesthetic and can be done on multiple toes. The upside is that it has an excellent success rate. Studies are underway to quantify this, but from personal experience, most dogs who have had this procedure done will benefit from it. Those who don't may have other complicating factors such as previous injuries to the toe, which reduce the success. The downside of the procedure is that it does result in a permanently flattened toe. So just so you can see what a toe looks like after a tendon release, the procedure that is usually done these days is the one shown on the right, where you can see that one toe is flattened. So this toe here is flattened compared to the rest. On the left, this is a dog that's had 2 double tenotomies. So on these toes here, both the superficial and deep flexor tendons have been released. This makes the toenail kick up as well as the toe flatten. Sometimes we'll need to do this procedure if the response to releasing just one tendon isn't enough. Lastly, in this section on pad problems, I just wanted to quickly talk about boots. So you'll see a lot of greyhounds wearing them, especially in suburban and city areas these days, and they really are more than just a fashion statement for the medical reasons that I've discussed this evening. So boots can be life-changing for dogs with chronic toe and pad pain, and they can make more difference than anything else that we can do for our dogs. However, a word of warning that not all dogs will tolerate them or walk in them, and so not every dog will be a candidate for them. Dogs should also not be left unattended with them on, mainly because they're likely to get chewed off. And we also need to be mindful of using them for prolonged periods in hot weather. So dogs sweat through their pads, so booting them up for long walks in hot sun can exacerbate heat stress. So just be sensible. And watch out for areas of rubbing, which can happen especially if boots aren't fitted properly. Moving on, I just wanted to quickly talk about paw cuts or lacerations, including tears in the webbing of the toes. So the webbing is the soft tissue here between the toes. These will usually need veterinary attention, and depending on how large and deep they are likely to need stitching and antibiotics. One major problem we have with cuts on paws is, especially if they're on the underneath surface, they get really dirty really quickly. So you may need to use some basic first aid on your dog before you make it to the vet. This might involve stopping the bleeding, so usually by applying pressure with a wad of tissue or gauze, cotton, or a clean hand towel. So greyhounds are great bleeders, and you may need to bandage your pressure swab onto the paw until you can make it to your vet. If the wound has stopped bleeding but has lots of dirt in it, you may need to clean it. This can be done with warm, salty water. So half a teaspoon of salt in 1 cup of boiled water, and then that's left to cool down, and then you dry it. Finally, a bandage may be needed to either help control blood loss or to stop further dirt contamination of the wound. So I'm just going to show you quickly how we bandage a greyhound's paw. Having a supply of basic bandaging materials at home is a really good idea if you're the owner of a retired greyhound, and knowing how to use them properly is really important. So in the video, you can see the vet nurse is padding in between each toe with cotton wool. This is actually a product called Soft Band, but you can get cotton wool on rolls, or even use the little balls and just kind of pull them out so they look a little bit elongated. And it's really important to pad between the toes because it stops greyhounds getting pressure sores or rubs in between the toes, which is a really, really common bandaging complication that we see. So you pad in between each toe, and also in between that metatarsal pad and the digital pads at the back or underneath. And then generally what we would do is put another layer of that absorbent material right around the paw, so kind of holding everything together. I'm just going to advance a little bit for the next layer. And so this is a conforming bandage. This is a bandage that sticks to itself, and it's really, really stretchy. And the main thing that I want everyone to know about this bandage is that you have to be really careful not to put it on too tightly. So you can see the vet nurse is actually just kind of pulling it out and then just placing it on, so that she's not putting it on too tightly. You're just placing it on, and you use it to cover that initial cotton wool absorbent layer. And then the third layer of a good bandage is a more waterproof layer, like an elastoplast layer. And so you do the same thing with elastoplast. So pull it out first before laying it over the paw, because that helps you make sure that you're not doing it on too tight. And the elastoplast is a little bit more, I guess, water resistant and harder wearing. It's not completely waterproof, so you still need to put a plastic bag over if you're going outside. And the second reason we use the elastoplast is, you can see what's happening now is we're using it to actually stick the whole bandage up onto the paw. So if you don't stick the bandage up properly, you'll end up with it just falling off. Okay, bandaging can either be very good or very bad. So learning what not to do is really important. Getting it just right means not making it too tight so that the blood flow to the toes is cut off and the toes get swollen. Not making it too loose so the whole thing just slides off, like this one here. Making sure that it stays dry so that it doesn't macerate the toes, which is what's happened here. And also making sure that you have enough padding between the toes and over bony areas so that we're not getting pressure sores and rub marks. Okay, so I'm just going to quickly talk about a disease that we see in greyhounds called SLO or SLOD. This stands for symmetrical leukoid onychodystrophy, and it's an immune-mediated condition of the nails. What we see is loss of multiple nail casings from affected dogs, leaving the sensitive tissues of the quick of the nail exposed, which is what you can see here. These can bleed and are very sensitive to touches. It's like having your fingernails pulled off. In less acute cases, you can see the hardened tissue of the nail lifted away from the quick, like this photo here. So that's the nail casing or the hard keratinized tissue, and that is the quick there. The nails can appear really hollow. Often the first time a nail is lost, we just assume that the dog has caught its nail on something and pulled it off, which also does happen. But if we have a dog present with multiple nails lost in this manner, we're very suspicious of SLO. The treatment for this condition usually involves medication that suppresses the immune response, and we often use fish oils high in a fatty acid called eicosapentaenoic acid, and also biotin. Many dogs will also need prednisolone or other immunosuppressive medications. It's always worth checking with your vet if your dog has lost a couple of nails without obvious trauma to make sure it's not SLO. And lastly, before I hand it back over to Phil, just some advice about nail trimming. Most greyhounds will need their nails trimmed, sometimes every 6 to 8 weeks. And with so many being black in colour, pigmented nails that you can't see the quick is very common. So this makes it a little dicey to trim nails at home, as going too short and cutting the quick is relatively easy. So first, I want you to understand the anatomy of the nail so you know where the blood vessels and nerves sit. So the quick of the nail surrounds this nail bone there. So the quick, or the sensitive tissues, are going to be around here, and you can see that they almost come down to a little bit of a point here. When I'm cutting nails, I'll start by making a cut, just like this one, across the tip, and then I'll nibble carefully at each side. So my aim is to shape the nail around the quick rather than make one big bold cut across. I think it's better to take less off and do it more frequently than to try and cut nails right back, as you're more likely to cause bleeding this way. Some dogs are very intolerant of their owners cutting their nails. They don't like the sound or the pressure. And of course, if you do accidentally cut into the quick, it hurts. So sometimes better for these dogs to visit a vet to have this done. So just to have a quick look at the types of things that are available for nail cutting, my preference is this one in the middle, okay? I think these ones, the guillotine cutters, can crush the nails, and it's also not as easy to make really precise cuts and small cuts with them. Some people love a Dremel, which is a grinding tool like the one on the right-hand side, and some dogs are just absolutely fine with that. Others just don't like the feeling or the pressure or the vibration. So if you do accidentally cut into the quick of the nail, apply pressure with a cotton wool ball or a tissue and hold it. For nails that keep bleeding, wet a bar of soap down slightly and press it onto the end of the nail to form a soap plug. If none of this works, try to bandage on a swab or a cotton ball, and you may need to visit your vet to get help. But just to reassure you that it is very unlikely that your dog will have a major bleed from a toenail, even though it might look like a murder scene. And it's also very uncommon to get an infection from cutting a nail too short. So that's it from me tonight. Now that I've talked your ear off about paws and pads and nails, and I'm going to try and hand it back over to Phil.
Thank you very much. That's absolutely fascinating. And I know that my boy is just such a sook, and amidst that greyhound wail of death, anytime it's even suggested, we can go. In fact, I think last time we took him to the Sandown vets, he broke a new track record just trying to get away because he knew what was coming. It's a tough thing with some greyhounds.
It is, and unfortunately we need to, because it's a regular maintenance thing, it's all about trying to make the experiences as positive as we can, and not make it too traumatic for ourselves as well. And I think a lot of people just find it's a lot easier just to take their dog to the vet or the pet shop and have the nails done rather than struggle, having that struggle at home.
Yeah, I've certainly found that. Now, Dr. Bec, a lot of veterinary surgeons that I've met in my time at GRV tend to have a specialty, and yours is obviously with the greyhound. Why is it, what was the attractiveness of specialising in greyhounds for you as a veterinary surgeon?
That's a really good question. And I think everyone that's on this Zoom meeting tonight will probably be able to answer the question. They're just amazing dogs. I think, they are just, in general, they're just so good-natured, and as a veterinarian they are just the most beautiful dogs to work with. They're usually quite compliant. If you get them to lie down, they'll stay down, and so they're really, really nice animals to work with. And also from my perspective, I just find them a fascinating breed. They have so many idiosyncrasies in terms of their physiology and their anatomy and the types of diseases and syndromes that we see. So they're just a fascinating subject. So
fantastic. Okay, so as I mentioned at the start, we have collected some questions from many of the people who are watching here tonight, So let's go through a few of those that we've collected. First of all, how do I know, or how can I tell if my greyhound is underweight?
So this is a really good question, because greyhounds do have a different body conformation than other dogs. You know, they're usually quite narrow-waisted, especially, you know, in their racing condition, they'll be really narrow-waisted. And they're deep-chested. So some of those condition scoring charts that are made for other breeds of dogs, and they're usually kind of Labradors or Golden Retrievers, are not kind of applicable for a greyhound. But the principles still apply. So essentially, if you're looking at your greyhound, you shouldn't be able to see anything but the last couple of ribs. So actually being able to see the last couple of ribs on your greyhound is okay, but you shouldn't see the rest of them, but you should be able to feel them. So if you put your hand on the side of their chest, you should be able to feel them quite easily without having to press in. And greyhounds should have a really obvious way. So going from their chest, they should have a dip up to their waist. And then if you look at them from above, you should see they should have a bit of an hourglass figure. So just after the last couple of ribs, you should see it should kind of dip in or narrow. So there is actually a body condition scoring chart that GRV has produced, and I can share that on my screen, or I think probably people could find it fairly easily if you just Google it. And essentially it's a score from 1 to 5, where 1 is too thin and 5 is too fat. And most pet greyhounds should sit at about number 3, which is a little bit above their racing weight. So yeah, that's probably the best way to know.
Two years I've been doing this, and I still have to remember to unmute myself. The next question is, apart from brushing, is there any other at-home basic dental care that I can do for my greyhound?
Yeah, there is lots. And I honestly mean it when I said that greyhound owners are the best brushers. They really are. I have to say that I'm so proud of the greyhound owning community, because I think we have more people brushing their dog's teeth on a daily basis than any other pet owners, which is just amazing. But it isn't the only thing that you can do. And in some dogs are just really intolerant of it. So it's not a good experience for them. They get really stressed. The owners get stressed, and it's not nice. So there are lots of other things that you can do. Essentially, when I'm talking dental health to people, I try and say that the aim is to do something every day to help with their dental health. But that can be from a number of things, from brushing to giving a pig's ear or another type of chew toy. So anything that gets them chewing essentially will help with the teeth at the back, so their premolars and their molar teeth. There are also some special diets. So there's one diet in particular that has really big biscuit size, and the diet is designed so that the dogs basically bite onto the biscuit and sink in, and it scrapes off the plaque on the teeth. So that's really good. And then there's other things as well. So there are things like water additives. There are a few different types of these. One is plaque off. Another one is hexarinse. Sorry, I've got a dog pawing at me. But there are some water additives that help as well. So I think encourage chewing, brushing, using the dental diets, using the water additives. So all of those things combined really, really, really help. And ultimately, at the end of the day, it's quite normal for dogs over the age of 2 years, whether they're greyhounds or not, but greyhounds are predisposed to dental disease. But it's quite normal for dogs to need to have their teeth cleaned, usually under anaesthetic, every 12 months or 12 to 24 months over the age of 2. So kind of scheduling that into your dental health care routine is also really important.
And something that's probably connected, I would assume, is what natural remedies can we use on greyhounds to remove bad breath?
That's a good question, and actually I'm not quite sure that I'm qualified to answer that one. What I can say is that bad breath, bad oral odor is usually caused by bacteria in the mouth. And so honestly, mechanical removal rather than kind of I guess any chemical means mechanical removal. So that means actually scraping it off either with brushing or chewing is actually, you know, the best way of controlling or removing that bacteria. There might be some, you know, in terms of natural remedies, I'm not really sure. I think, you know, some of the things that we use will have chlorhexidine in them, which is an antibacterial, and again the aim is just to kind of reduce that bacterial load in the mouth.
Okay, now it was only a matter of time before the subject got around to poo.
Right.
Is sloppy or soft poo normal in greyhounds, and does this mean they're not getting enough nutrients from their food?
So I did say before, and I think everyone at GAP knows that I just love poo, and that's a really weird thing to say, but I just, you know, I spend a lot of my time looking at poop from greyhounds, and I think that yes, I do think that greyhounds have less well-formed feces than some other breeds of dogs, but it is dependent on what they're eating. It's also dependent on other environmental factors like have they been stressed recently? You know, have they been transported? Have they gone to the vet? Have they, you know, gone on a long car trip? Because transport often can make them quite stressed, and that can give them really runny poos. Have you changed their diet recently? Have they been in a kennel environment recently? Because we know that one thing we know about kennels and shelters is that, you know, gastrointestinal parasites are more common. And so we always treat for those and investigate those at GAP. And when I say I spend a lot of time looking at poo, it's just because, not because I really love it, but just because it's really important to kind of have a handle on what type of parasites we might have in our population. But yes, we do see, I think we see less formed feces in greyhounds. And when I'm talking to people about this, I always talk about the fact that, you know, a greyhound will often have more than one poop on a walk. So their first poop is usually the most formed. Okay, so that's usually the hardest one, because that makes sense. It's been kind of sitting in the lower or large bowel for the longest time, and the job of the large bowel is to draw water away from it. So the more water that gets drawn away, the harder the poop will be. So that first poop should be the most solid, and it should be well formed. But because greyhounds will often poo like 2, 3 or 4 times on a walk, what happens is the next poop that comes down hasn't been sitting in the colon for as long, and so it's not as dehydrated as the one before it, and then it gets kind of worse from there. So usually poop 3 might be quite liquid compared to what poop 1 was. So I always ask people to kind of go back to the start and tell me about what that first poop is like. And if that one is quite well formed, then it's usually okay. And I am a big fan of something called the Purina fecal scoring chart. And I don't know, Phil, do you want me to share my screen just quickly, and I'll see if I can find, I'm not sure whether I'll be able to find it on my computer, or people can just Google it, because if you just look up Purina fecal chart for dogs, you'll see that they've got a basically just like a chart with pictures of poop and scores from 1 to 7. When we're scoring at GAP, diarrhea is anything that's kind of 5 and above. So you can actually, you know, keep an actual objective score on your dog's poop at home if you so desire.
And good evening to everybody enjoying their dinner this evening. I'm sure my boy saves it up. I think once he gets out of the house on a lead, he goes, whoa, toilet time.
Yeah, they're pretty good at letting out and getting rid of everything. So, and I think that's why we see, this pattern that, they will poop multiple times on a walk, whereas other dogs seem to only go once and then they wait until next time.
I see Philippa has also just posted the link to that particular information that you were just discussing on in the chat. The next question is, my greyhound eats grass. Is there something wrong with her gut health?
Again, a very good question. And before I answer that question, I think I will usually say to my clients, put it in context. So is the dog otherwise well? So is there any sign of vomiting? Is there any sign of weight loss, any sign of lethargy, or anything else that might indicate that there are other problems going on? And are they doing it all the time? So eating grass every now and then, and even vomiting grass that they've eaten up is pretty normal for dogs. So they actually use it to kind of empty out their stomach, and that's okay. All dogs will do that every now and then. But if there are any of those other signs that I've mentioned, and particularly, if it's associated with kind of ongoing vomiting or weight loss or anything like that, then I would say go see your vet and just have a checkup and make sure, because there could be something else going on. And look, that could be so many different things. So I think put it in context with how the dog is in general.
Now, something I've noticed over years of dealing with greyhounds, they're fussy eaters, I found. The next question is, my greyhound doesn't seem to like a mix of raw meat and kibble, prefers only kibble. Is that okay?
That is absolutely fine. And I actually wish that every greyhound was like that. That would make me very, very happy. So the answer, I guess the question is really, do greyhounds need raw meat or any type of meat in order to have a balanced and healthy diet? And the answer is no. So at GAP, we have actually transitioned to a dry food only diet. I think if you're using dry foods, try and make sure that you've got the best quality one that you can afford. So essentially with dog foods, the more that you pay, the better the quality is how it generally ends up. So the ones available from kind of vet clinics and pet shops are usually what we call the premium quality dry foods, and so they're really highly digestible. They don't have lots of fillers like lots of cereals in them, but they do tend to be more expensive. Having said that, if they're better quality and they're more digestible, the dogs actually need to eat less of them than some of the cheaper foods, which are a lot of indigestible fibre that just kind of goes straight through them. So you end up having to feed a really big volume. You do not have to mix in raw meats or any other products with dry food. But the reason that sometimes we do is that the dogs like the taste of it. So mixing raw meat through, and especially because a lot of dogs have been raised on that kind of diet, and so they're quite used to it. And so you can imagine a dog looking at a bowl of dry food as opposed to a bowl of, cube steak or mince or whatever. It's like looking at cardboard versus, something really amazing. So often we have to use other things to increase the palatability of the dry foods to get them to eat it in the first place. But those foods actually have all of the nutrients that the dogs need. And in fact, they have all of the nutrients that racing dogs need as well. So it's not just a kind of a transition that we can make when they go from racing life to retirement, that they are balanced and okay for all dogs.
And of course, it goes without saying that fresh water is absolutely vital.
Absolutely. So you should always provide fresh water at all times. And just kind of as an indication, most people probably know about how much their greyhounds drink, but kind of normal water intake for a greyhound, and this is just you know, an observation, but an observation that I think a lot of other vets would agree with, is that greyhounds tend to drink less per kilo body weight than other breeds of dogs. But normal water intake for any breed of dog is about 60 mils per kilo. So my maths is not great, but I'm pretty sure that for a 30 kilo dog, that would mean about 1.8 litres a day. So just make sure that you are providing well in excess of that so that they can drink what they need. And the other thing that I'd say about water is just make sure that, especially in the hot weather, that it's somewhere in the shade, so water gets really, really, really hot in direct sunlight. So yeah, just make sure you leave it in the shade.
Excellent. And the other part of food is treats. What treats would you either recommend or not recommend?
Mm-hmm. Treats of all different types, and it's one of the great pleasures as a pet owner in actually being able to you know, to treat our dogs and to give them, you know, I guess, yeah, special things to eat. So, and also it's really important in terms of behavior training. So if you're using, you know, treats are really important for positive reinforcement when you're training. And I think that with treats, so there's just so much out there. I think most things are okay for condition that can be exacerbated by fat in the diet. So they're not kind of prone to problems with fat in the diet, but just don't overfeed them. Feed one at a time. So kind of only introduce one new thing at a time, just to see. It just makes it easier if your dog does have a bad reaction, that you can kind of sort through and work out what you think.
The next question is all about tips on recognising actual injury and pain versus a greyhound just being independent. Now, my boy steps on his own foot occasionally, and you'd think that he's just been arrested for robbing a bank. It's just the greyhound squeal of death.
Yeah.
Is there any way of telling what's real and what's a greyhound being a greyhound?
So, I mean, I think that's a really tricky question, because it depends on the dog. I think the greyhound scream of death thing is a protective mechanism that some dogs learn, especially some dogs that are a little anxious. They learn as a defensive behaviour. So, and it works really well. If you think about it, it stops you doing whatever you're trying to do pretty damn quickly. So I think that you have to relate it to the dog. So some dogs will use that defensive mechanism at the drop of a hat, and other dogs tend to be extremely stoic and won't activate that kind of, I guess, that coping technique unless, in fact, they'll never activate it. So they'll just stand and put up with whatever, you know, you are asking them to do. I think if in doubt, assume that it's pain, is what I think, because I, you know, as a veterinarian, I would just feel awful that I just thought my dog was, or my patient was carrying on when they were, you know, really in pain. So as I said, if in doubt, assume that there is a problem, assume that there is pain. And if there's not pain, I still think there's anxiety. So I think you should still acknowledge that greyhound scream of death, because I think your dog's telling you something, whether it's, you know, actually as bad as you think it should be. I think that dogs in pain, some dogs in pain, you know, the ones that especially don't do that scream of death will often just change their behaviour. And this is important for all dogs with pain. Often they'll hide it quite well. So they might just stop doing things that they normally do. And so that absence of behaviour is just as important sometimes as the presence of, you know, screaming or crying or limping or anything like that. So a dog that's usually happy and zooming around, that's just sitting quietly on its bed or looks really tucked up or doesn't want to get out of bed or doesn't want to eat when they've usually got a good appetite, is is a really good indicator that there's something going wrong. And I think that especially if that problem persists, then I think probably the best thing to do is take your dog to the vet to let them work out whether it's a carry-on or whether it's a true response. Because I too tend to find that in the vet clinic, we don't see that very often. Like, I don't think I see kind of greyhounds overreacting very often. They're either very silent, very strong, or they just tell me what's going on. But I think that they're probably a bit more difficult to interpret at home. But I think if it's persisting, assume it's pain, or if you don't know, assume it's pain.
Our final question in this particular format, although I see we've taken a few on the chat, and this is a subject that we've probably covered in the previous sessions, talking about fostering. Tips to support an anxious greyhound settling into their new home.
Yeah, and I think this is again a really good question. Because if you think about it from a greyhound's point of view, a lot of the dogs that come to you from the Gap kennels haven't ever been in our home before. So it's a really new environment for them, and it's a new world. And I think as pet owners, we're so excited. Sometimes we try and open up that world to them too quickly. So we want to take them down to the cafe, and we want to take them on a greyhound walk, and we want to take them in a car, and we want to take them to our friend's house. And these are all things that sometimes, for a dog that's just not been doing these things on a regular basis, it's too much too soon. So it's a sensory overload. So probably my best piece of advice for people is to keep their world, and you might have heard this expression before, but keep their world small to start with. So really just be mindful of the fact that this is just everything is so new to them, and trying to kind of keep them in a safe space, and so they're feeling safe is really important, and not expect them to be able to cope with too much too soon, and also have a safe and quiet spot for them to go to in your home that they know is theirs. So a bed, wherever that may be, and preferably away from kind of the main areas of the house that might be really busy and overwhelming for them, until they're used to it at least. So that's probably, I think, the most important piece of advice in transitioning a dog into a home. For dogs that are anxious, so there are a subset of dogs that are generally anxious dogs, and so these are dogs that I think they are often it's essentially genetic. So there are some of these dogs are born like this, so they just tend to be very, very sensitive little personalities, and some of those dogs do need additional support. So sometimes we have some dogs that go on some medications that just help them with transitions and with change. But I think that's the minority of dogs. I think most dogs, once they understand their new world, they live super happily in it.
Yeah, good point. That's the end of the questions that we've collected, but I know a few more have been collected within the chat section, and I'd love to hand over to my colleague Philippa, who will continue with that particular section.
Thanks, Phil. So we've had a couple of questions come through from the chat box. First of all, Claudia just wanted clarification. It must have been back when you were talking about greyhound diets. She just said, is it 500 grams per day?
Yeah, so probably the best way for me to answer this is I'm going to give you more numbers, but generally we're going to go back to what a greyhound, your average kind of 30 to 32 kilo greyhound needs in terms of its daily energy requirements. And for that, for most, average size greyhounds that are not racing or doing huge amounts of exercise every day, it's about 1,700 kilocalories per day. So what that means is, so most of your foods, your dry food diets, are going to be between about 3,000 kilocalories per kilo of food and up to some of the working dog diets, like the one we feed at Gap, is just over 4,000 kilocalories per day. So that works out to, if you need about 1,700 kilocalories, then you've got about 3,500 to 4,000 kilocalories per kilo of food. What that means is you've got to feed about half a kilo, so about 500 grams. So, you can do the maths yourself. So if you know that your dog needs 1,700 kilocalories, every single bag of dog food should have on the side of it, it'll say what the kilocalories per kilo content is. And so you can actually work it out more specifically. But Claudia, I think going off that guide, about 500 grams of a good adult or working dog food is usually good for most greyhounds.
Someone's asked, do they do a growl purr when enjoying being patted? So I'm not sure if that means when they do that chattering, or if it's something else completely.
Well, I might have to refer to another expert for that. I mean, I think some of them do the chatter is often excitement. So that can be a very happy behaviour if that's what people are asking. They don't tend to do it when they're kind of really relaxed, though. It's more an excitement thing. So maybe in anticipation of something good happening. So that is, I would characterise that as a positive behaviour, but I'm not sure if there's something more specific that people are asking about, Philippa.
Yes, she just said, do they do a growl purr when enjoying being patted?
If anyone, Sean or Jenny, if anyone feels like they want to jump in and answer that. Otherwise, maybe someone needs to send me a video of what they're doing. That would be great too.
Sure. I was just going to dive in and say, Bec, that from what I can gather, it is a pleasure thing they're talking about. I'm pretty sure that's what they're referring to, that pleasure, that pleasure chat when they hit the sweet spot, whether it's an ear rub or whether it's just a back rub. They go, oh, that feels really great, and that that's why it comes out as a bit of a little growl, but I don't think it's meant as a nasty growl.
Yeah.
Thank you.
So makes sense to me.
Ray has asked, how long should we expect them to be in a transition from kennel racing to home life?
And I know this is such an annoying response, but I'm going to say it anyway. It's different for every dog. So, it's hard to give you an average, because for some dogs it's like they're born to it, and they'll walk into a home after never having been in one before and they're all over it, whereas other dogs can take months. I mean, I think in average, when we're talking about transitions, we talk in a matter of weeks usually, but again, being mindful that we're slowly, and when I talked before about keeping their world small, the second part of that, which is probably what you're asking, is that you gradually do start opening up. But again, it's like the treat feeding. Do one thing at a time, and don't introduce too many things too quickly. So I guess the basic answer is, a matter of weeks, but it is different for every dog, and some dogs will take a lot longer than others. And sometimes we don't know that at all beforehand. So some of those anxious dogs, we might have a real indication that these guys might need a lot of time. But sometimes we're really surprised, because sometimes it's the really confident dogs in the kennels that go out and they go, I knew what happened back then. I'm not quite sure what's happening now. So it can be different for every dog.
Yeah. Jenny's just asked, some greyhounds have heart murmurs. Is this a problem in a pet home?
So So we do, a lot of people who have adopted dogs from GAP may have got a form with them saying that the dog's got a heart murmur. And the most important thing that I want everyone to take away is that mostly this is not problematic at all. So most of the murmurs that we hear in greyhounds are really, really quiet, low-grade murmurs, and they're probably not even indicators of actual heart disease, but more just about the anatomy and the physiology of the greyhound. So they've got great big hearts. They've got a lot of, big blood volume at their heart in any one time, but the actual outlet of the heart is, reasonably small. So it's kind of the same size as other dogs. And so they've got a lot of pressure or turbulence across valves. And so a lot of what we hear as murmurs in greyhounds is not at all an indicator of heart disease. And those dogs never go on to develop heart disease. They don't go on to, need medication. It doesn't shorten their lifespan, and it stays at that just kind of grade 1, almost can't hear it stage forever. But it is, we do have, just like in any other breed of dog, there are other dogs that have higher grade murmurs. So a higher grade murmur means a louder murmur. And those dogs, if they come through the GAP program, what we do with them is that we have a heart ultrasound done so that we can actually see with the ultrasound what the issue is and how it's affecting the heart. And then that gives us an idea about whether those dogs might need medication to help support them, and also, what their prognosis or outlook might be.
Awesome. Another question is thoughts on dealing with freezing. Our greyhound freezes on walks. I don't think she's overwhelmed by fear. She'll keep walking when exploring new territory. However, when we turn to walk home, freeze city.
Yeah, so that's really tricky. And I think a lot of people have probably been in this situation, and some people have probably even had to almost carry their dogs home because they won't go home. And I think, again, looking at the context, so is the dog freezing because it's frightened, or is it being obstinate? So it's really, really important that you know which of those things it is, because your management of them might be different. I think a dog that's being obstinate is always really tricky, and what I try and tell people to be, and I know this is really easy for me to say and hard to do in practice, but essentially with a dog that you think is being obstinate, be the gentle, kind, strong leader. And so what that means is kind of forging ahead and gently, but not kind of, not, I guess, pandering is not the right word, but just essentially you're just kind of, keeping on, moving on. You're moving on, you're putting gentle lead pressure, and I'm not talking about really dragging them, but just kind of quite firmly moving them. And if you have to get them started forward in the direction they want to go, and then turn around them so that you're turning them back around, and just keep walking, keep moving forward, eyes ahead, because they will read your body language, and hesitation on your behalf can make things a lot worse. A dog that's freezing because it's frightened, again, I'm going to go back to that, don't push them too hard too soon. So maybe scale down your walks. Don't go so far so that if you do have to carry your dog home, you're not carrying it 2 kilometres. But also don't forget that routine is really important for dogs. So maybe, as a lot of people like variety in their life, many dogs don't. So a lot of dogs like doing the same thing every day, and they actually like going on the same walk every day, and they like eating the same food at the same time every day. So for some of those dogs, just keeping a routine is really helpful, and keeping to the same walking route is helpful because it just makes them feel safe.
Awesome, thank you. And that's all the questions that were in the chat box. I'm not sure if Sean wanted to say anything or just head straight back to Phil.
No, sorry, yeah, I just wanted to say Bec's such an integral part of our program, and I guess on behalf of GAP and GRV, and Phil will probably echo this, but we really appreciate everything Bec does. She's so well respected in the greyhound world. Her knowledge is second to none. And you can see tonight just the passion that she brings towards the not only, I guess, our program, the Greyhound adoption program, but the breed. So Bec and I do work closely together. She's incredible. We'd be lost without her. And I guess on behalf of, as I said, on behalf of the adoption program and Greyhound Race Victoria, Bec, you do wonderful work, and we really appreciate your time and giving up your time tonight to speak to all these lovely, wonderful people out there.
That's very kind. Thank you very much. And look, to be honest, I feel really lucky that I have the opportunity to work with all of these people and with these beautiful dogs. And I have to say, I've just been watching the little screens at the top and watching people's dogs wandering in and out of the Zoom screen. And it's just the nicest thing to see, you know, dogs sharing people's lives like that. So yeah, it's lovely to be involved in that.
Thank you, Bec, and thank you for all. I did notice a comment there earlier saying that somebody wished that these were available. These videos will be available. Some of them are available already on the GAP website, which is gap.grv.org.au. We've already covered volunteering, fostering, and adoption. And of course, tonight's video will eventually be also accessible through that website. It's been a long one, but I'm sure you'll agree it's been a fascinating one, and we've all learned a great deal about the dogs that we love. Thank you all for attending tonight, and thank you in particular, Dr. Bec. It's been fascinating, and every one of us here has learned a lot more about those beautiful dogs that we love so much. I hope everybody will seek to find out some more information. Again, that gap.grv.org.au is the website, and that's really the entrance point for a lot of information about greyhounds, whether you have one now or perhaps whether you're looking for one in the future. I think that's all we have for this evening. Thank you all for coming. Thank you for listening, and thank you for participating. Have a wonderful week and a wonderful weekend. Thank you and good night, everybody.